All the world bodies now recommend breast milk, human breast milk, to be this standard of feeding for all babies, including premature babies. However, breast milk, especially term, is inadequate in a lot of nutrients to support the growth of an actively growing premature infant. And whether you look at it on a theoretical basis or on the basis of studies done, cohort studies done, it's pretty obvious in protein, energy, calcium, phosphorus, maybe sodium and zinc and iron, all are in quantities, and vitamin D are in quantities that are not enough to support the growth of the preterm baby. That's why fortification is a must. Now with the WHO also saying that if a baby cannot be fed mother's own milk, it should be fed donor milk. Donor milk in most milk banks comes from mothers who have been lactating for many months, and therefore the protein content is almost universally less than 1 gram per deciliter. That means that the fortification has to be done, otherwise there will be growth failure. It's been shown over and over again that if you feed breast milk unfortified, there will be growth failure, and one of the components of that growth failure is due to protein intake content of milk, both term and donor. Preterm milk is transiently higher in protein for the first few weeks, but after that it becomes just like term milk. So for the long term, breast milk by itself is not a good solution, especially for the smaller premature infants. So the fortification strategies are many, but the current practical way of doing is to use the fortifier according to manufacturer's instructions, and then adjust the fortification based on growth and or some biochemical values like blood urea nitrogen. Otherwise, if you just do it, you assume that breast milk has a certain composition, but there's differences in composition of breast milk in the same day, between mothers, between expressions. Therefore, if you don't know what's in mother's milk, then you're fortifying it blindly. And so the new fortification methods will measure these components, and hopefully when they are approved and more precise, they will measure the protein content. Then you can fortify to a specified content rather than just blindly do it the way we're doing it right now.